Before any energy psychology technique or manual muscle testing can be used reliably, it is imperative to establish polarity. The brain works bilaterally. The right side of the brain sends messages, electrical messages, to the left side of the body. And the left side of the brain sends messages to the right side of the body. At the same time, the central and governing meridians or vessels will send chi upwards towards the head. When both of these occur, polarity is positive. Electricity, however, always has a positive and a negative current. When polarity is reversed, chi is flowing down towards the feet, and the brain is sending messages to the same side of the body or homolaterally. If the energy is running down, the person will often have slowed reaction time, be confused, awkward, display excessive moodiness, experience anxiety, have difficulty knowing their left and right, and display other learning disabilities. Essentially, everything is reversed for someone with negative polarity. When muscle testing is done with a person in this condition, the results become reversed or disorganized. This is because applied kinesiology essentially tests one person's electricity with the other person's electricity. So if either person is off, the results are switched or reversed. Switching is another way to describe negative polarity. Switching equals neurological disorganization, or ND. It is a neurological phenomenon primarily and an electromagnetic phenomenon secondarily. Checking for polarity is very simple. A clinician can use almost any muscle to effectively therapy localize, but the easiest and often the most accurate is to hold the dominant arm of the client out in front of them and at a 45-degree angle down and 20 to the side. In order to ensure accurate muscle testing, it is important to use firm and consistent pressure only after informing the client to hold and isolate the muscle. The best place to apply the pressure is slightly above the wrist. If the muscle testing is applied directly to the wrist, almost any pressure will cause the muscle to test weak. The clinicians should educate the client to not hold the muscles in the chest or the abdomen during the muscle test, as those muscles will be recruited to give extra strength to the arm muscle, rendering the test inaccurate. The client should also exhale during the test, as inhaling will inflate the lungs and again recruit the strength of their breath to artificially strengthen the testing muscle. There are two simple complementary ways to test for polarity. The first is to localize 2 points on the chest called the K27s or kidney 27s. These are the 27th acupressure points on the kidney meridian bilaterally. If these points test strong, it suggests that the brain is working contralaterally. However, the polarity point, which is located at the bridge of the nose, should test weak to confirm the polarity of the client. It is possible for the client to still be apolar even if they pass these two tests, although it is rare. It is possible to ascertain a more hidden apolarity by having the client put both of their hands on the K27s and then testing a strong indicator muscle of the leg. If this tests weak, they are switched. An even more subtle indicator, which measures a greater level of neurological disorganization, or ND, is to have the client reverse the hands so that the right hand touches the left K27 and the left hand touches the right. Again, if this muscle test is weak, the client is switched.